Welcome back. Wake Up Nigeria continues now. And on the couch with me, I have the pleasure of introducing our next guest, Mr. Oluwole Kukoyi. Now, he is the Chief Medical Director of ACE Medicare Clinic. He was the chairman of the Nigerian Medical Association, NMA, Ogun State branch, and pioneer member of the Association of General and Private Medical Practitioners of Nigeria, AGPMPN, in Ogun State. He is presently the national coordinator of Rotary International's Inter-Country Committee, that's the ICC, and he is here to have the cholera conversation. What is it we need to know? There's been, it's great to have you here, by the way. Welcome to the show.
Thank you very much for having me here today.
There's a lot of things going here and there about the issue of cholera. And we have to thank you for coming to talk to us about this today.
Thank you very much.
For those who are probably maybe hearing about cholera for the first time, please give us some insight into what it means.
Well, cholera, as we know, is a public health concern because it's a disease that we have the epidemic right now. And mostly it's caused by unhygienic ways of disposing feces and food. So it's mainly due to contaminated food and water. And that is why it is of serious health concern, public health concern.
Of course, from your profile, we had already read that you are a medicalpreneur.
Yes,
it would be
I am.
interesting for you to give us a little background so that we can understand how you are involved in, sharing information about topics such as this.
Well, I'm a medical entrepreneur of over 40 years cognate experience. I studied medicine in the University of Ibadan, and I graduated in 1980. After that, I worked with the state government before I established my own facility, private practice, which is the ACE Medicare Clinics that you just mentioned. And we're about 30 years old now in that hospital, and have been managing the hospital for that long. And, well, this issue of cholera, is, like I said, is a matter of a public concern. We currently have an epidemic in the Lagos state, which is spreading to other states. We woke up, I think, about 15th of June this year to the news that we have a very big problem on our hands, and that's cholera that we are talking about. And indeed, a lot of people have died from it, and that is why it is important that serious measures should be taken to contain the epidemic.
When you heard about the news, were you given any information as to how it began or where it began, or what exactly could have caused it to become such an issue?
Well, like I said, it's an illness that is caused by contaminated food and water. So along the line, something must have happened, to break that. And it's a disease that spreads so quickly. And unless it is managed properly, it continues to spread. And it's also a disease that has a high case fatality rate, about 5%, which means that for every 100 people that have it, about 5% of them will die, and that is a serious issue.
It is.
Yes.
But can I ask about the issue of the modes of transmission itself? A lot of information went out when the COVID outbreak happened about how it is transferred from person to person. How is it a little more or less contagious than things we've heard before?
In epidemic situations like we have, it is very contagious because when the food or the water gets contaminated, you can easily have the disease, and if it's not properly treated, and it will certainly spread, especially in areas where you have congestion, where there's overcrowding, where the sewage system is compromised. It can spread so fastly.
Sure.
And that is why it is important that, and that is why surveillance is also very good. You'll be able to monitor how it spreads, and you'll be able to contain it.
Well, I wanted to touch on the position you have just recently been conferred. I believe, Rotary, please give us an insight into what new conferment you received.
Well, I've just been installed as a district governor of Rotary International District 9111. And by that position, I oversee all the clubs in the district.
Wow.
Prior to 1st of July, we had a District 9110 covering all the clubs in Lagos and Ogun states. But because we have reached a critical membership strength, we had to divide into two, 9111 and 9112. So I cover 9111, which has parts of Lagos and parts of Ogun. And we have currently have 71 clubs in my district, and I oversee all these clubs.
So with this kind of reach, that you have with your number of clubs membership,
yes,
I guess this puts you in a position to make sure that the information about this outbreak, for instance, gets to all these different communities and all these different bodies. But what is it that Rotary is doing presently to make sure that they enlighten the people?
Of course, we have quite a widespread. We have 71 clubs, and that is spread across all the areas, all the local governments. And our prime aim is advocacy. Advocacy is very important, and that is part of our public image. We give information to the public at the right time. For instance, all the clubs I've visited, I mentioned it, and they also mention it on their everyday activities, and we have a large reach to all the communities that we're involved in, and it's been part of what we've been doing. It's an important part of our 7 areas of focus, which Rotary employs to reach the communities. So part of our function is advocacy, enlightenment, and also treatment.
You said 7.
7 areas.
7 areas. So obviously health is one of them. Right?
In actual fact, health is so important that out of the 7, 3 are related to health. So important.
Please shed more light on those 3 areas.
Yes, we have a disease prevention and treatment, and this cholera outbreak actually comes under that. Areas where we can do everything to prevent disease, like public enlightenment and giving vaccines, which is also a critical part of our work. Water and sanitation. Again, we are talking about sewage control. So water and sanitation is very key. So these are areas where Rotary actually does its projects to improve community.
So over time, we've had many conversations with many different experts who have talked about how important it is to involve the youth in all the future projects that they're working on, especially with regards to advocacy. And now we have the Gen Zs taking over the media, social media space these days. I'm wondering how your clubs, Rotary, as a body, are involving the youth in this advocacy and how they're informing the youth about this outbreak.
Well, you know, social media is so important in this kind of thing. And let me also tell you that we have what we can call a youth wing, the Rotaract wing, then we have the interactors. We are aware of this, and we are going headlong in the areas of social media involvement. It's a critical part of our public image. We know that the greatest form of information now is the social media rather than the traditional media. So we are exploiting that to ensure that information gets to the right people at the right time.
I'm really interested in hearing about Rotaract. And you said, is it Interact? What was the...
Yes, Interact is for secondary school pupils.
Interesting.
Rotaract is for older ones.
Older ones.
We even have the latest now is Rota Kids.
Rota Kids.
For kids in the
interesting, really interesting.
Primary school.
I know that this particular body has been here for a very long time, but you personally have also involved yourself in a lot of amazing work, even in Ogun State. Your hospital has been doing some really great work there as well. As quickly as possible before we wrap up, could you touch on some work you've been doing in Ogun State?
Well, Rotary has been doing quite a lot in the community. For instance, we have Rotary Eye Hospital, which is domiciled in my hospital. There we give free treatment to beneficiaries, especially for cataract operations and free glasses.
Wow.
So that's on one side. Recently, we commissioned, we did a foundation laying for my STAR project, which is Sickle Cell Disease Center.
Wow.
I mean, we all know the importance of sickle cell in our society. It's a very common illness, has a large health burden, disease burden, and we just thought we should be involved in this kind of thing. We did the foundation laying about a week ago, just 2 days after I came in as a district governor.
Well,
Let you know the importance of this project.
thank you so much.
Yes.
Thank you so much. You're doing so much in one. For one person, you're doing so much. You wear so many hats, and for you to have taken out time to come and talk to us, thank you so much for doing so.
Thank you very
I
much.
appreciate
Well,
you,
that's
sir.
what it takes to be a
So-
Rotarian.
So, with any final words on this cholera matter?
Well, the final word is that we should engage in safe, hygienic measures. By the time we do that, it's going to interrupt the spread of the disease. Hygiene is the most and the critical area where we can control the disease. There are other measures, but I think hygiene is the most important, and the awareness of the disease.
Thank you very much, sir, for coming to talk to us
It's
on
been
this.
my pleasure.
We
Thank
also here at TVC are already, in talks with some companies where we are trying to put out the word, the information about cholera as much as possible. We are going to be taking a quick break at this point. And thank you very much, sir.
Thank you for inviting me. I'm so grateful. Thank you.
Please share your thoughts with us. Use our hashtag #WakeUpNigeria on TVC and tag us WakeUpNigeria TVCE with your comments. Let's take a break.